This is our 13th episode of the podcast, and we're excited to have our guest today, the consummate professional who has been doing chiropractic care for many years and has been effectively helping patients. Today we have my colleague on the show, Dr. Charles Weiss of Holcomb Chiropractic. Welcome, sir, and how are you?
Hi, thank you for having me. I'm doing very well.
Perfect.
How about you guys?
It's Friday, and we're glad you're here. All right, so to get things going, Doctor, I know our time is limited. So tell us, how did you get into into chiropractic care?
Yeah, when I was a teenager, my dad had gone in for back surgery, and understanding, that I've inherited his body, really wanted to make sure that that my spine and my back were going to be healthy as I got older. So I met a chiropractor in the gym and went in for an evaluation just to make sure I wasn't kind of heading down the same road that he had gone on. And the more I understood about chiropractic and the way that the spine works with helping the body, it made a lot of sense to me.
And that's a good way to get into it, because sometimes you choose some career path and it's not as straightforward as what you explained.
Well, that's kind of an organic path to take. I like that.
Exactly. So, Doctor, tell us about your services, though.
Oh, yeah. So we're a traditional chiropractic office. We do chiropractic care. We also have a full physiotherapy suite. We do, electric stim and ice and heat and deep tissue massage and rehabilitation exercises. And then we also have a full x-ray suite in the back, because a lot of times when people come in, we're really trying to find out if there's some kind of underlying condition as well, or there's a trauma and we need to take x-rays. And we do some nutritional counseling in the office as well.
So you're really very holistic, if I could use that word. I mean, you're looking at the whole picture.
I think it's a great word to use. Yeah, the older term was complementary healthcare, and now it's more holistic, and I like that term a lot.
Yeah, so it sounds too like you're very keen on pain relief from just what you described.
Yeah, our belief has always been, we believe patients work through phases of care based on what their conditions are and what they need. Most people who come into our office initially are having some type of symptoms or pain. That's kind of what chiropractic care has come to be known for in the mainstream way. And so we're always helping people get out of pain and feel better. And then there's other ways to utilize chiropractic care in a healthy lifestyle as well.
So now with COVID, just based on what I know about health and healthcare, I'm thinking that chiropractic care is a great way to, if you keep your spine aligned, it's really important for your immune system or your immune function.
And
can you talk about that?
I'd be happy to. And that's been a challenge within the chiropractic profession, especially with something like COVID. As chiropractors, we understand working with the spine and nervous system and allowing the body to function at optimal care and optimal working helps the body do better and generally keeps people healthier. But to sit there and make a claim that chiropractic care definitely improves the immune system or can help with a COVID type situation, we want to make sure that the general public really understands that's not a connection. There's not a lot of, any scientific research that's been double-blinded and stuff that really shows those types of connections. But every chiropractor and a lot of chiropractic patients would tell you, we see this type of stuff in our office as far as helping people live healthier lives, but the science still needs to catch up with exactly how that works.
Which I'm thinking isn't going to happen for a while because we're focused on other things. But if you consider that we know that COVID is attacking the nervous system in some people, it attacks their sense of smell, their sense of taste. There's been brain inflammation. There's been all kinds of neurological complications from this strange virus.
Sure.
So it seems like, to me, that suggests that you'd want to keep those connections, functioning as efficiently and cleanly as possible, which chiropractic just shouts that.
I agree with that. I agree with that wholeheartedly. Yeah.
Okay. Yeah. So are you seeing are people coming into the office with COVID that you know of? Are you treating anybody at the moment?
We are not. The protocols for what COVID patients need to do are very clear through the Center for Disease Control, right?
Mm-hmm.
They need to go home and quarantine. They need to work through their issues medically, and then once they're not symptomatic for 72 hours, like no fever for 72 hours, then they can start to move out of quarantine and start to do other types of things.
Do we know if people are if they can still spread the virus even after 72 hours of no fever? Do we know that yet? There's still some. I think there's still some question about shedding the virus.
We're learning every day, right? This is a brand new issue, and we're having learning situations where the science and the research is changing on a regular basis. So, can asymptomatic people spread it? Could you get it again if you've had it before? We're still really understanding a lot of this stuff. So the best we're able to do is follow what the government guidelines are, and trying to keep ourselves and the patients who want to come in safe to the best of our abilities.
So what are you doing in the office? I'm assuming CDC protocol, but can you tell people exactly what you require when somebody comes in the door?
Sure. We are strong believers in people being masked and social distancing and washing our hands, as frequently as possible. We sterilize tables, and then space visits out. Luckily for us as a practice, we've never kind of bulked patients in with all the same visits. We've always wanted to give patients the amount of time they need for the care that they need. So the COVID protocols fit into how our office has worked for a long time.
Mm-hmm.
And doctor, it's obvious that you have a great process in place for COVID patients. But what about the patients who or the people who want to stay home? Do you offer telehealth?
So there's two things that we do. If somebody needs a non-office hour time frame, people want to come in with nobody else there at all. We see patients off hours. I'll see patients before we open or during our lunch break or after hours, so that they're the only people in the office. We've done that for a number of people who have high-risk people at home. And then some people want to have conversations about what they can do. So we offer telehealth for nutritional counseling or lifestyle management, in lengths of time that people need.
Is that new since COVID, or have you always done that?
We've always done that type of thing. It's a little more frequent during COVID because of that, but we've always done those types of counseling.
Okay. Let's know about the process of a new patient.
Oh, great question. So, our main goal has always been first to figure out if someone's in the right place, right? We want to make sure that what we're able to offer is helpful for the patient. And, so when they come in, they fill out a thorough health history. And then we sit down and do a consultation with them to find out kind of what their issues are, what's worked, what hasn't worked, other things that might be connected in their history that they might not realize are connected, and try to get a picture of what's going on and what things in the past have connected to that. And then at that point, we do an exam to kind of steer us in a direction of, are we finding the things that we think they're presenting with? And at that point, we kind of have a good understanding of, here's what's going on. And then do we need some type of diagnostic testing to either confirm that or rule things out, whether it's X-ray or MRI or nerve testing, things like that. And then at that point, we sit down and do a report of findings and kind of say, here's what's going on. Here's what we need to do, fix it. Here's what you need to do to help fix it. And here's the expectation of how long we think it's going to take, or if what we're doing isn't successful, here are the next steps. And then we work through the treatment plan with them and monitor them every time they come in as to whether we're attaining those goals.
Awesome.
That is so important. I think people underestimate that history taking piece. because it's amazing. We do something similar at the studio. We sit down and make them fill out lots of forms, but the more you talk to people, it's like the more they remember, because they don't,
Exactly.
no one sits down and thinks about this stuff for 45 minutes straight, right? It's just little snips and snaps. And it's almost like you're dipping a wick into their memory and they're pulling out all this stuff that they forgot about. And then you're able to make those links like, oh yeah, I broke my leg when I was 16 and they totally forgot about that. It's like, well, you limped around for 6 months, that might have something to do with your back now. So that, I think everyone should look for a chiropractor who's going to do exactly what you're doing, sitting down and having that long conversation, getting all that data before they decide what to do. Because it's not a simple, oh, that T12 is out, so let's punch it back in. It's not that. It's that bigger picture,
Right. Exactly right. It's lifestyle and body related together. I graduated from Logan Chiropractic College in St. Louis. So my level of training and the way that I just view patient care is very different than most of the chiropractors in the Atlanta area. And then my level of expertise with just postgraduate training. I've got postgraduate training in auto accident care and in sports injuries, as well as, we take our time with patients. And to me, that's always been very important. So the combination of those things, we believe we create a very different place in the marketplace here in Atlanta.
Yeah, post-grad work's incredible. I mean, there aren't that many doctors or chiropractors who have that. And that is a really good differentiator, because you can't tell. It's just like my industry, personal trainers. That's like, the guy at Gold's Gym who's telling you how to use the machines, or it's me or somebody like me. You can't tell who we are. In chiropractic, it's the same thing. You can't. There's the joint, right? They're chiropractors.
Right.
And then there's you, who is going to really take care of a person's health, not just their vertebra, So that's a huge differentiation. People should ask that question. Like, do you have any post-grad work? When they go in and interview a chiropractor.
Yeah, we had a patient just in on Thursday. And when we got done with the consultation, she said, that's more time than the other chiropractors spent with me for an entire first visit.
Yeah.
And it's you need time to really figure out what's going on and give a patient the right types of recommendations so that they can meet their goals of why they're there.
Right. Yeah.
So doctor, there's this broad view out there that chiropractic care is not that important. And so I want you to talk to our audience. Talk about the effectiveness of chiropractic care in our bodies.
Yeah, that's a great question. The challenge for us in chiropractic is, in the beginning of chiropractic, there were a lot of people who conspired to do away with it. They saw it as a competition. The medical field didn't embrace it at all. So research really lagged for a long time, and cooperation lagged for a long time. But in our offices, and our patients saw amazing results with all types of things. So we saw that, over 100+ years, that things were being very effective, but it was really hard to show it in a scientific way as far as headaches or back pain or just overall general health. Chiropractic care always has its limits, like every other type of health profession does. And it's important for doctors and patients to understand those. But it's also, it helps the body work efficiently. So a lot of times, chiropractors used to be the doctors of last resort. I've tried everything else. I don't know what to do. Okay, let me just go see this chiropractor. Nothing else is going to work. And then they would get the results. Now, over the last 20, 30 years, patients are looking at chiropractic care as the primary care it should be. In my belief system, you start out conservative on the rungs of the healthcare ladder. You start conservative, primary care, chiropractic, see what works from an effective standpoint. I'd rather have the body work efficiently. And then if that isn't working, then there's a need for medicine, or then there's a need for surgery. But giving the body a chance to do what it needs to do, to me, is always the best place to start.
I think there was a study just a couple of years ago that showed that chiropractic care was 85% more effective than drugs for lower back pain. Like,
absolutely.
That should be your first go-to. If you're having lower back pain, you should go to a chiropractor before you take a prescription drug. It was in the middle of that OxyContin,
right. And right now we are in the middle of an opioid epidemic.
Yeah.
And it's from doctors and patients trying to view things from a pain standpoint,
Right.
and it's really a functional standpoint.
Function, exactly.
Right. If you can
biomechanics.
get the body, and Anne Marie, you understand this perfectly because this is exactly what you do, is help people restore, mobility and function.
Yeah.
As the body does better in movement, it creates a healing process within the body that allows people to improve. Right. Most pain syndromes are really lack of motion, inflammation, and muscle spasm, and the pain is there secondarily.
Yeah, and misalignment. And what you do is align.
Exactly.
If you put it back in alignment, it stops rubbing the wrong way, and then it can heal. So it's really pretty simple, but doctors don't see it that way.
By just going to a chiropractor and getting an assessment that can show even bigger problems.
Right, and that's one of the things I talked about earlier. My initial goal is, are you in the right place? And every patient's entitled to more than one condition. So in doing a thorough health history and examination, are there other systems in their body that need evaluation? Do they need blood work to look at hormone levels? Do they need some type of further diagnostic testing to look at something? People have chronic problems and really haven't gotten thorough answers. So that's one of the areas I've really tried to specialize in my entire career, is trying to diagnose all of the problems that are going on, and then seeing what chiropractic care can help with, but also where the patients need help with other providers.
Right. I think I've seen that before. You have sort of a constellation of people that you work with that you can refer people out to when they need it, just like you're saying.
Right. I think that's vital as a chiropractor. Absolutely.
Yeah, that's really good. That's really good.
So what is the biggest? I think we touched on some, but what is the biggest misconception about chiropractic care?
Yeah, I think one of the old misconceptions is still really around a lot, and that's that once you go to a chiropractor, you got to go to a chiropractor for the rest of your life.
That's
what I've always told people is, I think once
you kind of should. I mean, you should go periodically, right, for maintenance.
Right.
So don't move.
But no one would have a problem to say, once you start brushing your teeth, you got to brush your teeth for the rest of your life, because they understand the mechanism of food getting on your teeth. Well, the same thing happens with your body, right? Issues happen. So most people come in with some type of a problem, and then once you get them better, sometimes there's a permanent underlying condition like degeneration, and chiropractic care can help that along the way. But it's periodic care. It's not this intense care that they come in with. And some people grasp that and it's important to them. And other people are like, hey, you know what? The next time I have a problem, I'll come back in. And both of those are fine. So there's not this, you have to do anything. But some people have an issue that requires some level of ongoing care. It's just not going to get better. What you're really doing is trying to prevent the aging process in those areas. And adding chiropractic in as part of a healthy lifestyle makes sense for some patients, and for other patients, they don't need that.
Have you seen, it just occurred to me when you were talking about that, have you seen an uptick because people are sitting at a screen probably even more than they did before? Have you seen an uptick in patients?
Yes, in every decade, there's a new problem. I think in the 70s, they called it disco thumb. And then when computers came around, there was a lot of carpal tunnel syndrome and things. And now with mobile devices and more people even working on laptops and at home, it's called tech neck, because everybody's head is bent down.
Yeah, it used to be forward head syndrome.
It's forward head syndrome, but it's because of technology.
Yeah.
And it really, the people who are under 30 now, this is their physical challenge. Right. More than anything, is they're creating this long-term chronic strain to their back and their neck because of the way that they're using technology.
Yeah, their bodies are going to remodel. They're remodeling right now.
They're remodeling constantly because the average screen time is 5 to 8 hours a day.
God. Yeah, well, and now and COVID has really it's like on steroids. It's terrible.
Yeah, right, and the average person doesn't have an ergonomic desk in their house. They're working at their kitchen table
or on the sofa,
exactly, or a couch with a coffee table, or even a desk, but it's not really a computer desk. So the nice thing is there's a lot of inexpensive ergonomic things to help that along and make workstations better for being at home. But people have to spend a little bit of money and improve the technology so that their posture is the best it can be while they're working.
And they should come to you. They should come to you like once a week and get,
of course,
get restored to some semblance of normalcy.
Yeah.
At least temporarily.
What types of diagnostic testing do you do in-house?
That's a great question. We use orthopedic and neurological testing. That's part of our exam to see what's going on with the nervous system and then the way that the joints move. We have a full x-ray suite in the office as well. And then we've always referred out for MRI, blood work, and even psychological evaluations. Sometimes the emotional stress that people are having is a big factor in the way that their body is manifesting problems.
So you're trying to decide chicken or egg? Is that why you do that? I mean,
by the time somebody comes in, it doesn't even matter chicken or egg because both the chicken and the egg are there. Right? So
gotcha.
the question becomes, what is there something that's causing the underlying problem beyond what chiropractic care can do? So again, if somebody's having chronic headaches, is it a spine-related issue? Is it a hormone-related issue? Is it a nerve-related issue? Or is it a combination of all three? It's really nice if it would just be one, but with a lot of patients, it's a combination of things. So chiropractic care is amazing when their headaches aren't resolving to the extent that they should be. Sometimes there's a hormone imbalance that's just continuing to affect that. And they would need more diagnostic testing to figure that out.
So if somebody comes to you and I think this is another thing that I've heard people complain about, like when you go to a chiropractor or they're just trying to get your money because they want you to come, twice a week for 10 weeks or something. Can you talk to that? I mean, it's begging the question here.
Sure. I think in every profession, there are people who have a game plan for their customers before that customer comes in. And hopefully it's very evident when you walk into a place like that. From our standpoint, we have very straightforward thought process. I don't know if I can help you until I evaluate what's going on. I have no preconceived notion of what you'll need. Once we've evaluated you, we can set up a game plan of what we think will work. And then as we start to work through that game plan, is it being effective? So we do what's called a trial period of care. It's 2 to 4 weeks. It's usually around 2 weeks is what we're doing being effective, because then we know we're heading you in the right direction. If it's not being effective, then either A, we need to change what we're doing, modify our techniques and our thought processes, or B, look further as there might be another underlying condition that didn't show up initially, but is preventing somebody from meeting their optimum goals.
That should be on the front page of your website, because that's very different. That you're reassessing, like we do. You're reassessing, and that's great. Because then you can adjust the course, or modify the sales or whatever metaphor you want to use. You can course correct immediately.
Right.
You get it right away, and then you know what to do. So that's awesome. And I think that is unique. And again, testimony to the fact that you're trying to truly solve the problem. That's
of course.
That's all you care about.
And that's so important, to find a professional, healthcare professional who's, want to help the client. It's not all about, what the money. Right. It's about helping the client and solving the problem.
Yeah, I believe I'm a servant in your healthcare journey. And if I can help along the way, that's great. And if I can't, I can at least steer you in the direction that somebody else might be more beneficial for what you need. And that's served us very well because our patients really take that to heart. They know what we want is what's in their best interest.
Fantastic. So, doctor, do you take all types of insurance?
We do. Now, there's certain insurance in Georgia that doesn't cover chiropractic care, like Medicaid. But as far as all the major medical and Medicare, we accept insurance.
Right.
That's great. So tell me, from your perspective, where do you see chiropractic care in the next 10 years? Where do you see that going?
Yeah, the important thing that we're seeing right now is chiropractic care taking a front line in the opioid crisis, right? Of people really being tired of just being prescribed pills for every little thing, and chronic pills, being on pills for just chronic problems without getting to the underlying issue. So a lot of patients are starting to view chiropractors as a primary provider. We've always been portal of entry, meaning you could always come to see us directly without a referral. But most importantly, that I see, is the medical doctors are starting to understand that.
Wow.
They're not wanting to prescribe those medications on a long-term basis, and they're looking for other options. And the research on chiropractic care definitely helping with pain and function is there. So they're really starting to embrace that and going, you know what? We're going to do this short term, but also let's start looking at function, which is wonderful, right? It's always in the best interest of the patient. If we can help get a patient well as conservatively as possible without being on something like a long-term opioid.
Yeah, that's a dream come true. I mean,
it really is.
That's fantastic.
I've been preaching that for almost 30 years now, and it's nice to see medical doctors embracing that concept as well, because medical doctors ultimately want what we all want for our patients, is them to get well. And what they're seeing is sometimes their model of care isn't being effective.
Right. It has a limit, just like everything else.
All healthcare models have things they do really well and other things that are challenging for them.
Right.
That's great. Fantastic conversation. But doctor, I know we're running out of time, but I want to shift a little bit. If you can tell us one thing in life that you need to invest in more, what would that be?
That's a great question. And I read something about a week ago, and it really hit home for me. And that was, you need to take time every day to invest in your own emotional health. So set a specific time aside where you're doing something just for you, whether it's exercise or meditation or reading a book or going through some projects in your house that have created mental clutter in your own brain, but just having that quality time for yourself, because if you're not taking care of yourself, it's difficult to help other people.
That's right.
And I think what's going on with COVID, that really has hit home for a lot of people. We've all had to slow down a little bit, but that's been a really great thing.
Yeah. So the stress is, it's always there. It's not going away until this thing goes away. So that's really important.
It's excellent pointer. So, doctor, how can our audience reach you?
Right. They can always call our office. The phone number is 770-992-8337. And we're available online at holcombridgechiropractic.com. And there's links on there to communicate with us or read things from our website or fill out patient forms.
What does your schedule look like right now? Are you booking ahead, or can people get in?
We have always kept openings in our schedule because there's emergencies that kind of happen every day. So we never overbook or cluster book patients. Right. So we always have time throughout the day to get somebody in. For almost 30 years now, we can always see patients same day or at most the next morning.
Perfect.
Okay. Doctor, I think we're at our end now for time. Thank you so much for taking the time out. We know that you're out of town and you still put us in your schedule. We appreciate that. And it was a fantastic conversation, and we learned a lot about chiropractic here. So thank you again.
Yeah,
well, thank you guys. I love and appreciate you, and thank you very much for the opportunity to be with you.
It's our pleasure. Be safe out there.
All right, thanks, you too.
All right, thanks, sir. Have a nice weekend. Bye.
All right, take care.